There's also lots of behaviours that we might seek to change in our professional lives. So in this context, for example, we know social workers are often asked to make a lot of changes in the processes and things that they have to adopt. And ultimately, often they can find that hard, really struggle to have capacity, even when they know it's for the best. They've got a myriad of other things that they are putting first. So essentially in all areas of life, we are often trying to change behavior, and if you've ever done this, then you probably know that it's really hard, but it's also crucially important in order for us to deliver improvements, embed new services, things like that. They all require some level of behavior change. Thankfully, we have something to help us, and that is behavioural science, and that really helps us to succeed at this behaviour change challenge. Essentially, behavioural science focuses on using scientific methods to understand behaviour and its drivers. So both internal drivers, things like decision making, and external drivers, all the context and things that are going on around people. It then uses that understanding to design interventions, and we can often, for example, look at scientific evidence of what's worked in the past to really help us to understand how best to do that. And it also gives us various methods to really evaluate impact and look at whether the things that we are doing are working. So, for example, we might see a carer who is avoiding engaging with support services, and the outcome of that might be that their needs remain unmet, they worsen in terms of stress and burnout, and overall just like doing really badly. Another behaviour that we might frequently see is they might be cancelling personal plans or health appointments, skipping meals, not really looking after themselves. And that might result in a real decline in physical and mental health, reduced resilience, and ultimately a much higher likelihood of crisis or need for emergency intervention. And hopefully you can see from this how some of these behaviours that we might see that are quite common can really drive outcomes that are detrimental not only to the individual in terms of their health and well-being, but also in terms of how they're engaging with the system and us as service providers. And ultimately, in order to change those behaviours, we really need to think about what's driving them. So what's kind of a step back from those behaviours? So by identifying these drivers and really understanding, it tells us what to design for in order to kind of change those behaviors and ultimately drive those outcomes. Because understanding the behavior really leads to better solutions. But we can enhance this better quality motivation by looking at three different things. So firstly, we can try and enhance people's autonomy. So how in control they feel, how much agency they feel they have, how much they feel like they have control and choice over their situations and actions. Next up, competence. So do people feel like they have the right level of challenge? If something is far too difficult, people are unlikely to be motivated. And lastly, relatedness. So feeling really connected with other people is something that's really important to us. And this autonomy, competence, and relatedness make up three really fundamental, like basic psychological needs. And when we serve them with the products or services that we're delivering, then we're much more likely to help people to feel intrinsically motivated to engage.
From the very start at Mobilise, we have baked behavioural science into all of our products as a science-led way to bring the human into the digital space we inhabit. Even our cuppers have a behavioural science-backed formula, and our content, our written content, our videos are actually all briefed through a combi model lens. So we've been using behavioural science, from the off. But for the purposes of framing our chat today, I'm going to talk specifically about how we have been building this into our dynamic carers assessment. And while the focus of today's webinar is on discussing how the behavioural science is weaved in to support the carers, towards the end, I've saved a little bit of time just to spend a few moments focusing on how we are building behavioural science into the back end for the social workers, for the case managers who would be using this tool. Because, well, let's face it, learning a new tool is another thing to do. So the design for the social workers, the case managers, it really needs to work, it needs to bring value, and it needs to enhance their lives as well. So first off, it reduces friction. There is no long, complex form to complete. You don't need to put aside hours to do this. Instead, it's a 20-minute conversational AI voice call. And it's at a time, like I said, a time to suit the carer. So there's no wait for this. The only wait is one that the carer has decided on. If they want to do it next Tuesday, that's fine. And that means that they're having their assessment when they have capacity for it, which improves capability again. It provides an immediate feedback loop. So catching the carer in the moment, building on their ability to take action right there and then. So I've said I want to have my assessment this afternoon because I feel I have capability and capacity to do that. And as soon as my call's finished, I get my support needs summarised and shared back with me. The support plans update automatically with you. So if I've had my assessment on Monday and by Friday my lovely dad's in hospital, we've had a hospital admission, I can just reply to the messages to say that, and the support will update in the moment and provide me with support to meet my new needs. So that improves my capability in that moment, which is really important. The tool is creating psychological safety. Rosie talked about that sort of fear of sharing information and judgment. Well, actually talking to AI removes fear and judgment and social pressure for a lot of carers. And I've shared just a couple of quotes here from carers that have used the tool. One said it was actually quite liberating as it's a bot, not a person. It takes up less social energy. And the beauty here is that you don't get discharged. You don't have to start again. The plan and the conversation and the support sits there waiting for you. But I did promise that I'd spend a little time on some of the behavioural science treats behind the scenes too. So for the case management, because the tool can only work for the carer if it works for those using it. But essentially behind the scenes, there is this user-friendly dashboard that helps you manage those cases. And ways in which we've built behavioural science into this include sort of helping with cognitive load for the social worker or the case manager. We provide clear summaries. There's an eligible needs summary. There's a safeguarding summary. There is also, you can go in and see more detail. There's the support summary that the carer has approved. And that frees you up from long narrative notes or free text assessments. It can help reduce decision fatigue that you may experience because the risk signals and the safeguarding prompts and the structured triage that's built in there help guide you through what to look at first and next. It can help support faster and more confident prioritization with visual risk scoring and clear what needs attention now cues. And it minimizes administration burden as well, because the system captures the full conversation and builds the assessment automatically. Imagine that, that's all been done before you have to do anything. You need to be able to trust this tool, and you have the ability to go through and see everything, all the transcript, the conversations, while you're building confidence, or if there's something that's just a little concerning, you want to go and find out more information, it's all in there. And also the fact that the carer can update with bits of the new support need that's happened without having to be re-referred and go through everything again. And that's a huge cognitive effort for the carer, but also for the person having to do the reassessment. And it protects bandwidth for complex cases. This tool, as I said at the beginning, is for those carers that require information, advice, and guidance at this point, really. And if this tool can carry that weight and the time that takes for you, it is freeing up capacity to work with the carers that have the more complex needs.